This is the AVATR retractor. It's used for partial sternotomies as well as a mid-cab approach. The beauty of the AVATR is that you can use it in a mid-cab or in a partial sternotomy. The base begins with a pillar clamp that goes on the arm of the retractor. The H-bar goes through the pillar clamp. You can get an angle of attack, whatever you want, whether it's shallow, deep, based on the position of the H-bar. Tighten the H-bar, and that creates a secure base for building up your retraction. Then you can add a rake by using the pillar clamp, and just to emphasize, the pillar clamp is infinitely adjustable in terms of where you position it, how you position it, and how much depth, how much retraction, the angle that you want. It's infinitely adjustable. And then you tighten the ball clamp and you have it in place. Depending on your approach, if you're in a mid-cap position or you're a hemisternotomy or a partial sternotomy or a mini sternotomy, you can position the pillar clamp on the arm to give you the angles of attack that you would like for your procedure. This is the standard position and the standard orientation of the pillar clamp on the arm of the retractor. And the way we have designed this retractor, it allows you to move the pillar clamp to give you a different angle of approach. So it goes at right angles to the normal orientation. So depending upon your approach, whether it's a mid-cab or sternal approach, you can still get the flexibility and exposure that you want. So this is pretty standard in this position, but it can be placed in this direction. You can get the position you want, the angle you want, the depth that you want, the amount of retraction that you want. The ball clamp securely locks it in place, giving you a secure retraction that is less obtrusive than an assistant holding the rake, and certainly more consistent in terms of the application of force and direction of force, that there is no human variability. And that is the beauty of this system. It can be used for either mid-cab approaches, sternal approaches to approach the heart.